Hello and welcome to my channel. In this video we will be looking at AQA AS Psychology 2022 Paper 1 Exemplar Answers for Psychopathology, which you need to know for AQA A-Level Psychology. I hope you enjoy this video and find it helpful. Let's get started. Please note that these answers have been produced with knowledge of the mark scheme but have not been approved by the mark scheme themselves. There are 3 assessment objectives, AOs, in psychology. In this video they are color-coded. AO1 Knowledge, purple. AO2 Application, blue. AO3 Evaluation, red and green. In AS there are 12 mark questions, instead of 16 mark questions. For the purpose of this video and to avoid confusion for A-Level, the 12 mark questions have been turned into 16 mark questions. Rita is talking to her therapist about her phobia of dogs. I am terrified of dogs. When I see one, I cannot move until it has walked away. I cannot go to my friend's house any longer because she has 2 dogs and I shake when they come near me. I try not to leave the house in case I see one on the street. Question 1. Give 2 behavioral characteristics of phobias that would be seen in someone who has a phobia of dogs. Refer to Rita in your answer. 4 marks. 1 behavioral characteristic of phobias is panic, with sufferers exhibiting behaviors such as crying, running, screaming, freezing, fainting, collapsing and vomiting in the presence of their phobic stimulus. Rita shakes in the presence of her friend's dogs. 2 behavioral characteristic of phobias is avoidance, with sufferers often going to great lengths to avoid the object or situation that triggers their fear. This can significantly limit their daily activities and social interactions. Rita is no longer going to her friend's house where a dog might be encountered, and Rita tries not to leave the house in case she sees a dog on the street. Question 2. Explain how the therapist could use systematic desensitization to treat Rita's phobia of dogs. 4 marks. Rita would be taught relaxation techniques she could use when she encounters dogs as part of the therapy. Rita would devise her hierarchy so it reflects her least to most feared dog situation, for example, hearing a dog bark, picture of a dog, then seeing a dog through a window. Rita would then be exposed to dogs gradually, ensuring she is relaxed at each stage. Question 3. Describe 1 cognitive explanation of depression. 4 marks. Ellis, 1957-1962, proposed the ABC model, which suggests that depression occurs as a result of irrational thoughts, beliefs, and assumptions. Ellis believed that everyone holds a unique set of assumptions or beliefs about themselves and their environment that guide them through life and determine their reactions to the various situations. Some people have masturbatory thought processes, which causes them to impose unrealistic demands and expectations on oneself or others. This sets them up to fail and guides them to irrationally interpret events and act and react in ways that are inappropriate and prejudice their chances of happiness and success, as such high expectations inevitably lead to disappointment, with extreme feelings leading to depression. The model proposes that an activating adversity or event, A, in the environment triggers an irrational, or rational, or unrealistic negative belief, B, or thoughts about why the situation occurred, e.g. masturbation, utopianism, which then causes a consequence, C, in the form of an unhealthy emotion, feeling or behavior about the belief, e.g. anxiety, depression. In the case of depression, a person may be given a poor evaluation of their work, activating event. This may then trigger a person to irrationally believe that they are a complete failure and will never succeed, belief, which then may cause a person to never put effort into their work again and feel unhealthy emotions, such as worthlessness, consequence. These unhealthy emotional feelings of worthlessness result in depression. Question 4. Outline and evaluate statistical infrequency and deviation from ideal mental health as definitions of abnormality. 16 marks. Statistical infrequency is defined as abnormal behavior, thinking or traits that are statistically or numerically rare, uncommon, or anomalous within a population. It relies on the use of up-to-date statistics and focuses on the quantity of behavior measured in standard deviations from the mean rather than the quality, occupying the extreme ends of a normal distribution curve. For example, low IQ is defined as an intellectual disability disorder, but high IQ is also defined as an intellectual disability. A strength of statistical infrequency as a definition of abnormality is that defining abnormality using statistical criteria can be appropriate and effective in many situations. For example, this approach allows for a clear and objective measure of behavior, making it easier to identify individuals who may need help. By quantifying behaviors and mental states, it provides a systematic way to differentiate between normal and abnormal functioning. This can be particularly useful in clinical settings, where mental health professionals can use statistical data to inform diagnoses and treatment plans. Additionally, it can aid in the identification of rare disorders that may require specialized intervention, ensuring that individuals receive the appropriate support tailored to their specific needs. This is a strength because it suggests that statistical infrequency provides a reliable framework for identifying abnormal behavior, which can lead to timely and appropriate interventions. By using objective data, mental health professionals can make informed decisions about diagnoses and treatment, ultimately improving outcomes for individuals who may otherwise go unnoticed. Additionally, it helps create a standardized approach to understanding mental health, which can be beneficial in research and clinical practice. A limitation of statistical infrequency as a definition of abnormality is that some disorders are not statistically rare. For instance, conditions like anxiety and depression are relatively common in the general population, yet they can still be considered abnormal in terms of functioning and behavior. This means that using statistical infrequency alone can lead to mislabeling individuals who experience common psychological issues as normal, while overlooking those who may have rarer conditions that significantly impair their daily lives. Furthermore, this definition does not take into account the social context or cultural norms, which can vary widely. This is a limitation because it suggests that the definition of abnormality may be too simplistic and fail to capture the complexities of mental health issues. By relying solely on statistical infrequency, it overlooks the importance of context, individual experiences, and the subjective nature of what constitutes abnormal behavior. This could lead to inadequate support for individuals who are struggling with common yet significant psychological conditions. Deviation from ideal mental health is defined as behavior which fails to meet a particular prescribed criteria for psychological normality, well-being, and good mental health. Jahoda, 1958, proposed 6 criteria of optimal living for ideal mental health, with an absence of these characteristics indicating an individual to be abnormal. The criteria includes an accurate perception of reality, being realistic and objective about oneself and the external world, ability to cope with stress, being able to effectively deal with the challenges of life without excessive stress, environmental mastery, the ability to successfully navigate work, social, and other situations, self-actualization, achieving personal growth and progress, realizing one's potential, positive attitude towards oneself, being happy with who you are and having self-respect and self-esteem, autonomy, being independent, self-reliant, and able to make decisions for yourself. The more criteria someone fails to meet, the more abnormal they are. A strength of deviating from ideal mental health as abnormality is its positive, holistic approach to diagnosis. It focuses on the entire person's well-being, considering emotional, psychological, and social factors, rather than just the absence of mental illness. This approach encourages individuals to strive for their best selves, rather than fitting into a normal category. For instance, addressing overall deviation from mental health might be more effective than focusing on specific symptoms. This definition can reduce stigma by recognizing mental health complexity and contributing factors. It leads to tailored treatment and a supportive environment for those with mental health challenges. This is a strength because it suggests that mental health should be viewed through a lens of positivity and growth, rather than simply as the absence of illness. By focusing on the ideal aspects of mental well-being, It encourages individuals to pursue self-actualization and overall fulfillment. This approach recognizes that everyone has unique experiences and needs, allowing for more personalized and effective treatment strategies. Furthermore, it promotes a more compassionate understanding of mental health, helping to destigmatize those who may be struggling and fostering a supportive environment for recovery and growth. A limitation of deviation from ideal mental health as a definition of abnormality is that it uses subjective measurements. It is hard to quantify how much a person is self-actualizing, or the extent to which they are able to master their environment, because measuring such characteristics relies on patient self-reports, which take personal perceptions and interpretations of what constitutes as good well-being or functioning, and therefore these methods may be unreliable, as each individual is likely to have varying opinions on what it means to be mentally healthy based on their personal experiences, beliefs, and cultural backgrounds. This reliance on subjective criteria can lead to misdiagnosis or inappropriate treatment, as mental health professionals may interpret behaviors and feelings through their own lenses rather than considering the unique context of each individual. Moreover, the subjective nature of these measurements can also contribute to stigma, as individuals may be labeled as abnormal based on arbitrary standards that do not take into account the complexities of human emotions and experiences. This is a limitation because it suggests that individuals must meet certain criteria to be considered mentally healthy, which overlooks human experiences and the fact that many people can function well without fitting into these rigid definitions. It also places undue pressure on individuals to achieve an often unrealistic standard of well-being, which can exacerbate feelings of inadequacy and lead to further mental health challenges. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.